Good afternoon, everyone. My name is Reverend Lance. My goal is to raise mental health awareness. I believe that a lot of crime is the result of a mental illness that went unchecked. Some people don't know what to look for when it comes to mental illness. Like, for example, I have a bipolar 1 condition, and some of the signs of my illness would be racing thoughts, inability to concentrate, mainly talking really fast, those and going days without sleep. That's some symptoms of that. With schizophrenia, some symptoms would be hearing voices, having auditory or visual hallucinations, tactile hallucination, meaning feeling things that other people can't feel, olfactory hallucinations, which means smelling things that people can't smell. For bipolar and schizophrenia, fall in the category of psychosis. A psychosis is a severe mental illness or mental disturbance. And an example of a psychosis is being out of touch with reality. Let's face reality. We're dealing with mental illness. Many of us don't want to accept mental illness because it's being stigmatized on so many different levels. We have really improved in mental health awareness from the 1970s compared to the 70s. One of the biggest books that has a big trend is The Myth of a Mental Illness. Mental illness is not a myth, and we need to get that out of our vocabulary. Like physical illnesses, mental illness, you will be taking medication for the rest of your life. Psychosis means being out of touch with reality. It's a severe mental disturbance, and bipolar and schizophrenia fall in the category of psychosis. Neurosis, the two illnesses that fall in the category of neurosis is depression and anxiety. Some signs of depression would be long periods of sadness, loss of interest in life, sleeping long periods of time, or even going days. Some people may have a bipolar 2 condition where they have a little bit of mania in their category. The difference between bipolar 1 and depression is that, but to be bipolar, you have to experience both mania and depression to be bipolar. For bipolar 2, you have to experience both depression and hypomania. So you have depression, people who are feeling low and they're feeling the blues, and then you have bipolar 2, where they have more periods of depression, less periods of hypomania. We typically don't want to go see a shrink when we're feeling good, but we need to go see a shrink if you're feeling like you're on top of the world, or you're doing excessive shopping. Anything done in excess can be a sign of your illness. But the key is, when it comes to mental health, so for some people, it affects everyone differently. For me, if you don't see me writing, then something wrong. I like to write, so that's a key right there. With depression and anxiety, you have to find things that you're passionate about. That's the key to overcoming that. Depression is, they have antidepressants and anti-anxiety medications to combat depression and anxiety. It's a neurosis, meaning neurosis is the least severe mental illnesses, the least severe illnesses. Depression and anxiety falls under the category of neurosis. Thank you.